Okay, Valentine, are you ready to go see your auntie?
Yes!
Let's go.
I have so much to tell you.
My sister! Sister, what is it? What's happened to you? Have you fallen ill?
I took to some illness.
Oh my
The
gosh.
doctors call it human papilloma virus. It's also called HPV. I'll take this also so you can see my hair.
Oh, this is really hard for me to hear, my sister.
I just started chemo and it just made me feel sick. I don't know, I thought it was a family thing, but I had sex. It's a STI according to what my doctor said, and anybody could get it. So I think I did. I was thinking I hadn't had sex in a long time, and then it was just one mistake, and I went to the doctor. I wasn't feeling good. They said I had cancer, and it was from HPV.
Auntie, what is HPV?
HPV, human papilloma virus. It's like when you have sex, it's like a sexually transmitted infection. It causes warts in your body. I didn't get it because apparently not everybody gets the warts, and some people don't have symptoms. So I didn't know that I even had it till I went to go get checked out, and I found out that I had cervical cancer, to be honest.
Hey, my name is Dr. Stan. How can I help you all today?
Hi, Dr. Stan. I'm here today with my daughter. And my sister was recently diagnosed with cervical cancer that she got from HPV, and I was wondering if you could tell me a bit about that.
Oh yeah, so HPV can actually cause a lot of different types of cancers, including cervical, anal, vaginal, and vulvar. And this STI can cause warts on various parts of the body, and it's the most common STI that people have in the United States. And a lot of people who have HPV, they don't even develop any symptoms, so they can infect other people without even knowing they're infected. This can be easily prevented with a vaccine at like the age of 9 to 11. So
My daughter is 10.
oh yeah, so it would be a good idea for her to get the vaccine.
Even though she's not sexually active?
Yeah, so this vaccine is usually given before boys and girls are sexually active to be the most effective.
Okay.
So there are 3 different types of HPV vaccines, but the one that is used in the U.S. is Gardasil 9. It's the only one that has been proven to prevent HPV-related cancers and diseases in the U.S. since 2016, and that's Gardasil 9. And for most people, HPV clears on its own, but for others, it can cause certain cancers later in life, like your sister. And the CDC recommends that the HPV vaccine be given to girls and boys between ages 11 to 12, and it can be given as early as age 9, like we said about your doctor. And it's ideal for girls and boys to receive this vaccine before they can be exposed to HPV through sexual contact. The usual dosage for this is a 2-dose series, and it can be given today and then in 6 months. And then there's also a 3-dose series, which can be given today and then a month or 2 from now, and then 6 months after that. So this vaccine works by causing the body's humoral immunity to produce antibodies that will bind to the HPV virus and prevent it from infecting cells. However, the HPV vaccine will not be effective if the individual is already infected.
But what are some side effects that it could cause?
Be like various side effects that are common in any type of vaccine, like pain, redness, or swelling where the shot was given, or in rare cases, dizziness or fainting, and nausea.
What about adverse effects? So
some adverse effects to the vaccine would occur if the patient was allergic, and symptoms include hives, swelling of the face and throat, difficulty breathing, tachycardia, dizziness, and weakness.
Oh, can you tell me more about the vaccine?
So this vaccine needs to be shaken very well before use, and agitation before the administration of the vaccine is necessary to maintain the suspension of the vaccine. And this vaccine should be given intramuscularly. Usually it's given in the deltoid region, so your arm is going to be sore for a little while. And you should definitely not administer this product intravenously, intradermally, or subcutaneously. The patient will just sit for 15 minutes after the vaccine is given to make sure none of those side effects or anything.
Okay. I think I might be pregnant soon. I'm trying to get pregnant. Would it be okay to breastfeed while I'm getting the vaccine?
So you should not breastfeed while you're getting this vaccine, while you're in dosing schedule of this vaccine. And this vaccine does not protect against any other STIs, and the only 100% effective way to not get an STI is to practice abstinence.